Introduction. Importance of vitamins. What vitamins are and why they are essential for health. Vitamins are organic compounds that are needed in small amounts for various physiological functions. They act as coenzymes, cofactors, or regulators of metabolic processes. Without adequate intake of vitamins, the body cannot perform its normal functions and may develop diseases. A deficiency in any vitamin can lead to health problems. Introduction to vitamin D. Vitamin D is a fat-soluble vitamin that is unique because it can be synthesized by the skin when it is exposed to ultraviolet B (UVB) rays from the sun. Vitamin D helps the body absorb calcium and phosphorus, which are essential for building and maintaining strong bones. Vitamin D also supports the immune system, the nervous system, the muscular system, and the cardiovascular system. A definition of vitamin D. Vitamin D is a group of fat-soluble corticosteroids that have a 4-ring structure with a side chain. The two main forms of vitamin D are vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Vitamin D is responsible for enhancing the intestinal absorption of calcium, magnesium, and phosphate, and for regulating the serum levels of these minerals. B classification. Fat-soluble vitamin. What the difference between water-soluble vitamin and fat-soluble vitamin? Fat-soluble vitamins are vitamins that dissolve in fat and can be stored in the liver and fatty tissues. They do not need to be consumed every day, but they can accumulate in the body and cause toxicity if taken in excess. Water-soluble vitamins are vitamins that dissolve in water and cannot be stored in the body. They need to be consumed regularly, and any excess is excreted in the urine. Sources of vitamin D. Sunlight exposure. 1. Mechanism of vitamin D synthesis. The skin contains a precursor molecule called 7-dehydrocholesterol, which is converted to provitamin D3 by the action of UVB rays. Provitamin D3 is then converted to vitamin D3 by a thermal isomerization reaction. Vitamin D3 is then transported to the liver, where it is converted to 25-hydroxyvitamin D, 25-OH-D, by the enzyme 25-hydroxylase. (25-OH-D) is then transported to the kidney, where it is converted to 1,25-dihydroxyvitamin D, 1,25-OH-2D, by the enzyme 1-alpha-hydroxylase. 1,25-OH-2D is the active form of vitamin D that binds to vitamin D receptors, VDRs, and regulates gene expression. Vitamin D synthesis. 2. Factors influencing synthesis. The synthesis of vitamin D through sunlight exposure depends on several factors, such as latitude. The closer to the equator, the more UVB rays reach the Earth's surface and the more vitamin D can be produced. For example, people living in Australia or Africa can produce more vitamin D than people living in Canada or Scandinavia. Season. The angle of the sun changes with the seasons, affecting the intensity and duration of UVB rays. For example, in the northern hemisphere, the sun is lower in the sky during the winter months, reducing the amount of vitamin D that can be produced. Time of day. The sun is highest in the sky around noon, which is when the most UVB rays are available. For example, the optimal time for vitamin D synthesis is between 10 a.m. and 3 p.m. Skin pigmentation. The darker the skin, the more melanin it contains, which acts as a natural sunscreen and blocks some of the UVB rays. For example, people with fair skin can produce more vitamin D than people with dark skin. Sunscreen use. Sunscreen products can filter out some of the UVB rays and reduce the amount of vitamin D that can be produced. For example, a sunscreen with a sun protection factor (SPF) of 15 can reduce vitamin D synthesis by 99%. B. Dietary sources. 1. Some of the natural sources of vitamin D are fatty fish. Fish such as salmon, mackerel, tuna, and sardines are rich in vitamin D and omega-3 fatty acids, which are good for the heart and the brain. A 3-ounce serving of cooked salmon can provide about 450 U of vitamin D, which is 75% of the recommended dietary allowance (RDA) for adults. Egg yolk. Egg yolk contains vitamin D and protein, which are important for muscle growth and repair. A large egg yolk can provide about 40 U of vitamin D, which is 7% of the recommended dietary allowance (RDA) for adults. Cheese. Cheese is a source of vitamin D and calcium, which are essential for bone health. A 1-ounce serving of cheddar cheese can provide about 12 U of vitamin D, which is 2% of the RDA for adults. Mushrooms. Mushrooms can produce vitamin D when exposed to sunlight or UV light. They also contain antioxidants, fiber, and minerals, which are beneficial for the immune system and the digestive system. A half cup of sliced mushrooms can provide about 10 U of vitamin D, which is 2% of the RDA for adults. Please stay tuned for the next video to complete the topic. Thanks for watching.